Morning, artist in recovery / Darryl P. It's 1:57 in the morning West Coast time. It's the 8th of March 2025, Saturday. Yeah, I got to bed concerning about your sister. Not easy dealing with a condition that pops up in your family's history. The picture that you put out there, beautiful looking lady during that time. And it's alright to feign ignorance, but it's also more compassion to understand your sister's condition. It's not the easiest thing to go through, especially when you have something of this profound nature happening. And it's something she's been living with and dealing with, which I'm kind of surprised you hadn't talked to her in a long while regarding this. MAR8.org has a lot of information about a lot of things out there. I did a search on this. I'm going to get the link for you. And they're talking about it. They're talking about it. I'm pausing the video of yours, so I can comment on it. I'm not going to jump down on your case on this one here, dude. This is one of those things that you still have to learn it the hard way. And it's not easy. It's not easy dealing with this kind of a situation. It never is. I can't say my family had been healthy in their own situations. I'm already discovering the horrors about diabetes the hard way. My family had had history of it. So I had a history of hypertension and blood pressure. We've had strokes, heart attacks, and cancer in our family lines. And it's not easy dealing with that kind of condition when you learn about it in your family and hoping to avoid it and discovering you can't. It's never easy. What I was reading about on the Mayo Clinic, they got an overview on this one, so I was hoping to give this information to you. According to the MayoClinic.org, lupus is, and I'm quoting it off the screen, lupus is a disease that occurs when your body's immune system attacks your own tissues and organs. An autoimmune disease. Inflammation caused by lupus can affect many body part systems, joints, skin, kidneys, blood cells, brain, hearts, and lungs. It's difficult to diagnose because symptoms and signs often mimic those of other ailments. The most distinctive sign of lupus, a facial rash that resembles the wings of a butterfly unfolding across both cheeks, occurs in many but not all cases of lupus. Some people are born with a tendency towards lupus, which may be triggered by infections, certain drugs, or even sunlight. While there's no cure, treatments can control the symptoms. And the symptoms are, no two cases are alike. Some of the stuff I've been coming across here are affected by it. Fatigue, fever, joint pain, stiffness, swelling, butterfly rash on the face, skin lesions, fingers and toes that turn white or blue when exposed to cold or stressful periods, shortness of breath, chest pain, dry eyes, headaches, confusion, and memory loss. Causes: inherited. Triggers: when something in the environment happens. And the cause of lupus is still unknown. Sunlight, maybe exposure, maybe at one point in life. Infections, they can trigger it. Medications, um, anti-seizure medications, antibiotics, high blood pressure. Those who have drug-induced lupus usually get better when they stop taking medications. Rarely, symptoms may persist even after the drug is stopped. Risk factors: sex, it's more happening in women. Age, diagnosed between the ages of 15 and 45. And race, it's usually more common in African Americans, Hispanic, and Asian Americans. Complications: well, the kidneys, serious kidney damage, brain and central nervous system, headaches, dizziness, behavior changes, visions, strokes, or seizures. People with lupus experience memory problems and having difficulty expressing their thoughts. Regarding blood or blood vessels, um, reduced number of healthy blood cells, red blood cells, increased risk of bleeding or blood clotting, inflammation of blood vessels. Lungs would have a hard time. Uh, Increases chance of developing an inflammation of the chest cavity lining, which can make breathing painful. Bleeding into lungs and pneumonia are also possible. For the cardiac, inflammation of heart muscle, arteries, or heart membrane. Risk of cardiovascular disease and heart attacks increase. Infections, cancer, bone tissue death, pregnancy complications. I wish I had better news on this. I wish there was a lot. But I understand that there are treatments out there for it. According to Mayo Clinic, I was trying to pull this information up regarding it. There's not one test that can diagnose it. It's a combination of blood and urine tests, signs and symptoms, and physical examination, according to what they're saying is. CBC, which is a complete blood count, erythrocyte sedimentation rate. It determines the rate of the red blood cells settling to the bottom of a tube in an hour. Faster than normal rate may indicate a systemic disease, such as lupus. Sedimentation rate isn't specific for any one disease. It may be elevated if you have lupus, an infection, or another inflammatory condition or cancer. Kidney and liver assessment, urinalysis, anti-nuclear antibody test. It's a positive test for the presence of antibodies, which indicates a stimulated immune system. While most people with lupus have a positive anti-nuclear antibody test, most people with a positive do not have lupus. Imaging tests, echocardiogram, chest x-ray, biopsies. Treatments depend upon symptoms and signs, determining which particular medication and the risks and the benefits of the medication in order to treat the conditions. As the signs and symptoms flare and subside, your doctor may find that you'll need to change medications or dosages. NSAIDs, ibuprofen, naproxen, Motrin. It may be used to treat pain, swelling, and fever associated with lupus, but the stronger stuff available by prescription. Sometimes the side effects may include stomach bleeding, kidney problems, and increased risk of heart problems. And then there's the anti-malarial drugs. Hydrochloroquine affects the immune system. It can decrease the lupus flares. Side effects: stomach upset, damage to retina or eye. Regular eye exams are recommended when taking these drugs. Corticosteroids. Prednisone is one of those drugs. High doses of steroids, such as Medrol, M-E-D-R-O, are often used to control serious disease that involves the kidneys and brain. Side effects include weight gain, easy bruising, thinning bones, high blood pressure, diabetes, and increased risk of infection. The risk of side effects increase with higher dosage and longer-term therapy. Immunosuppressants, drugs that suppress the immune system, may be helpful in serious cases of it. Um, the drugs they've got, like oh, good lord, let me just read the other names for it: Imurin and Azathan, uh, Celcept, Trexol, and other kind of drugs. Potential side effects may have an increased risk of infection, liver damage, decreased infertility, and increased risk of cancer. They say biologics, a different type of medication. Benlysta, administered intravenously, also reduces the symptoms in some people. Side effects: nausea, diarrhea, infections. Rarely worsening of depression can occur. Rexitan, Truxima may be beneficial for some people. Some of the medications haven't helped. Side effects: IV allergic reactions to IV infusion and infections. It takes on many forms, Darryl. I'm only reading what the Mayo Clinic has on this stuff. They got trials out there. Self-care they got. Seeing a doctor regularly. Sun Smart. Regular exercise. They tell you not to smoke. Try to eat a healthy diet. Fruits, vegetables, whole grains. Maybe you have diet restrictions because of blood pressure, kidney damage, or stomach issues. Vitamin D supplements, calcium supplements. They also have alternative medicine mentioned on here. But it's going to be up to the doctor if he wants to do the Western treatment other than the alternative um, supplements, fish oil, acupuncture, support groups. Darryl, this is a whole new thing that you're entering in right now, and you're probably scared as hell about it. I hear you, pal. I hear you. I've just quoted some of the stuff I've got off the Mayo Clinic website. I think you should look at it and talk it over with your sister. Darryl, you know I do the channel Diary of the Griever named John Weaver. And you know that I deal with loss of family and friends on a great deal. I talk about it a great deal. It's not the easiest thing to look at, knowing that one day family's going to be going. Family's everything to us. It's everything. My brother was in it. I mean, he didn't say a bad word to about Ma in any way, shape, or form. Otherwise, you'd get thumped. My brother and I were family long before he got into the military and had his behavior changed a great deal, but he was family. And to lose family is one of the hardest damn things. That's one of those things that you just can't get a drug or anything else to replace it. Never. I hadn't lost my family over immune disease systems. Cancers is one thing in the family, genetics. Lung cancer for one particular uncle. Cirrhosis of the liver for an aunt. Dementia for another aunt. Heart issue for another uncle. Suicide. And in my own genetic line, it's almost self-destructive nature, I guess we have. My brother was alcoholism, but it didn't kill him yet. Well, during those days. Just about turned him into a zombie. Alcohol and drug abuse. It wasn't overeating that killed him. I didn't even know his love of Coca-Cola was killing him. And smoking. Two primary factors that knocked his ass out. Plus he had diabetes to contend with. He didn't stroke yet, but I don't know what it was. They said it was respiratory infection. Must have picked it up at the hospital. Ma, she was a slow deterioration. She had many strokes. I did mention a while ago in my other videos that Dave actually had trans ischemic attacks that took away speech, mobility. So it was hard for him to communicate what the hell was going on with him when he didn't even realize it scared the shit out of him all the damn time. I'm discovering more and more through diabetes situations about what it's like. I mean, I'd seen my family go through it. Now I'm going through it. And then it scares the hell out of me that I have to deal with the medical establishment for a long time. I've been staying the hell away from them. Not wanting to be tortured to death by tests or anything else for that matter, but sometimes I may not have a choice. I'm wondering if the testing was going to be worse than the disease itself. But I already know about heart disease and I already know about strokes. Concerning about that, since my family suffered through that. I've seen how it taken away communications and intelligence, memories. Debilitates a person. And about having heart problems, well, I was born with a hole in the heart that had to be replaced. Had to be worked on at the age of 4. I know what it feels like to die. I'm not looking forward to that one either. I don't make a joke about the thing either, dude. So I live with that. I live with the memories of conditions my family's had, different things that could have taken me out. So I live with that on a constant basis. Talking about it helps me out a great deal. In regards to your sister's condition, a support group would be one way of understanding the condition. How other people are trying to live with it. How the caregivers are dealing with it. Especially when they're family caregivers. It would give you a little bit of a basis regarding emotional stability, which you're going to be dealing with. If you happen to do a 24/7 on her, then you need to know what you're running into, dude. You have to. And then understand it's going to be taking a hell of a lot out of you. But if you are a true brother, we'll talk more about it. about being a caregiver. You wanted to find me, you know where to reach me, pal.